Anesthesiologists administer the drugs that put people to sleep during virtually every surgery performed in hospitals, but there's only one of them left working at the Swift Current Hospital. He's in his mid-70s.
What this has sort of resulted in is it's difficult for one person to keep the entire surgical program afloat. This particular anesthetist is in some ways his own type of hero. He is doing far more than I think could be expected of anybody. He is really pushing himself, as far as I think, farther than anybody should be asked to be quite honest.
Garcia says the shortage affects all hospital services.
I would have a full surgical day ready to go. But when we only have one anesthetist, you have a couple of surprise cesarean sections suddenly come on board. Well, of course, baby takes priority. And I've had entire days lost because of that. And it's not much I can do about it.
One woman recently gave birth in Swift Current. The anesthesiologist was only on shift for the first part of her labor.
Quite nerve-wracking, scary. Didn't know what was, coming my way. So, yeah, it was scary for sure.
A healthy baby was delivered, but Evanson still needed an emergency surgical procedure to remove her placenta.
They decided that I had to go to the OR for a removal. With that, they said I need conscious sedation. The conscious sedation is normally performed by an anesthesiologist.
An emergency room doctor had to give her the anesthetic, and the surgery was a success.
Luckily, I had a great nurse at my side. The doctors were great too, but it's just unfortunate that they're all put in that position, that they didn't have the normal team that they have to do the procedure. So yeah, it was scary for sure. I was quite nervous, and especially right after giving birth to a baby and already having emotions running high, and then having that happen was unfortunate for sure.
Several pregnant women we spoke to say they're nervous about going to Swift Current to have their babies.
So if they say, hey, there's no anesthesiologist right now and you're in active labor, you have to make that choice. For me, I'm not willing to take that risk if there are the service disruptions in place while I am in labor. So yeah, a lot of factors come into play that just add an extra level of stress that really shouldn't be there.
Provincial health officials say it's still safe for most women to deliver their babies in Swift Current. They say patients are assessed upon arrival, and if they are deemed to be a high-risk delivery, they're transferred to an alternate hospital able to provide the required services. Restoring full access to all services remains the priority. Provincial health officials also say there's a national shortage of these kinds of specialists, but they're working hard to hire more. Jason Warwick, CBC News, Saskatoon.